Building downtown. Building downtown. Building downtown.
Hey, this is Building Downtown. You can follow us on social media at The Building DT. You can subscribe to the show on YouTube, iTunes, Spotify, wherever you get your podcasts from. I'm your host, Jason Kelly. You can follow me at JKellyMMA. You can follow my co-host, Kirill Kasatskiy, at Krill Raps. You can follow my other co-host, Amy Barton, at Ames Bell. So tonight's guest has been with us. He's been 2 shows now. He's become kind of our resident doctor, talked us through a lot of this COVID stuff at different stages. Living in Ontario, we thought we were in the clear. Even the other day, Kirill and I were talking because we live in that province. You know, it's looking up. It's looking like we're going places. And within 2 days, just shit the bed again. So joining us to update us, help us know what the hell is going on, what to expect, where we're at with all this. Dr. Faisal Rehman, how's it going, my brother?
Great. Thank you so much for having me on again, guys. It'd be great if we could talk about something else other than COVID, though.
Yo, Krill and I were just having that conversation. We're like, wouldn't it be nice to have him on sometime and not talk about this bullshit?
Let's talk about head injuries and people beating each other up, and violence, and we're still talking about a virus.
No,
I could use a head injury right now.
Exactly. Me too. You know, in London, it's funny you said that. We just had another mini outbreak at University Hospital, and it's just driving me nuts. You know, and I think it's people in the community are going nuts. It's very, very difficult times right now, and people want to see a glimmer of hope. And I'm still very optimistic, but there's a lot of unknowns, and when you have unknowns, that's what frustrates people, because we can't really predict. You know, I couldn't tell you when I'd be able to fly to the States just for a family vacation. I can't tell you what date that would ever be possible. You know, I have friends preparing for the Olympic Games in Japan, and it's weird because they're proceeding as if it's going to go ahead. The Olympic Committee's proceeding as if it's going to go ahead, and in the midst, the world is still dealing with new infections and new variants and new mutations, and it's just the whole world has become schizophrenic.
I've seen some videos of Japan having water pool raves already.
Jesus!
They put it
water pool raves.
Oh yeah. Oh yeah.
That sounds dangerous even without this shit going on.
That's true.
Everyone who's high out of their minds, get in the deep end.
Exactly.
Holy Christ.
Let some fluids out.
Yeah, the Olympics, that's an interesting one too, because borders are shut down, everything. They really don't want people going too far out of certain zones, even down to cities in some places, provinces, whatever. And that's just representatives from all countries, not all, but a ton of countries all over the world. Is that, even though there's going to be a ton of testing, I would assume, is that just a disaster waiting to happen, in your opinion?
I mean, I just don't know what the fuck is going on. Like, no country is speaking up about the Olympics. Nobody has the balls or the guts to say anything. The athletes, I just worry. I hope they're not being given false hope. They're being told to proceed as if this is going to happen. The Japanese people themselves do not want people coming to the Olympics. They don't want people from all over the world congregating there. Now, mind you, it would just be athletes. And I know that the organizers are taking every precaution possible to make sure that if the Olympic Games are held, it's held in the safest environment possible, no audience, you know, and really the athletes will be properly housed and isolated, I suspect, with testing. But I still think it's, at least at this time, it's highly irresponsible. Would I be comfortable holding the Olympic Games now? No. It's going to be interesting to see what happens by the end of July. You know, right now, we don't even know. We know that the vaccines work in terms of preventing people from getting sicker. So if I'm vaccinated and I get the COVID-19 infection, I would have a less severe manifestation of the illness, or I would be asymptomatic, which is good. But what we don't know is, does the vaccine actually prevent you from carrying the virus and transmitting it to others? So until we have, you know, mass amounts of people, or the vast majority of the population vaccinated, I'm not sure if it will be safe. And I think it's going to be tough to get the world vaccinated by July. And you know, so I want the so-called experts who are, you know, on CNN every day talking about everything. Nobody has said a shit about the Olympics. Like, it just drives me crazy. And yet, and then the International Olympic Committee is saying, you know what, we're going on, we're going, we're good to go. Everything's good to go. The Japanese congregation says we're good to go. But and athletes are being told to get ready and show up for qualifying competitions, and I just it just baffles me that the world leaders are not speaking up about this, and maybe they feel that in July we'll be good to go. I don't know, but the way things are right now, I'm not sure we'll be good to go.
I mean, they've managed to move the whole UFC to an island, right? Maybe they create a bubble like that too. Maybe that's
In Japan.
yeah.
I mean, it is an island, so there's that.
Right? They might try.
I mean, I think that ship has sailed since the UFC is selling tickets to their Jacksonville show next month. So
That
that's
one was
happening.
interesting to me. You got the Apex in Nevada, I think it's in, and then you got Fight Island. I didn't think they'd move out of there. And the Jacksonville one, I'm like, you might be pushing it now, guys.
That's interesting. Amy, do you know what audience number they will accept there? Like, is it only open to 2,000 fans, for example, who are socially distanced, or does everyone have to wear a mask? Like, do you know any details about that?
No, I don't know any details. The most, and I'm not fucking around here. The most educated guess I can give you, being very privy to Florida knowledge, is that it wouldn't surprise me if all restrictions are lifted, but before then in the state anyway.
Oh man.
So it's up in the air. I mean, I don't think you're going to have a high percentage of people hoping to have guidelines in place. It's not one of the states that's been particularly positive about that this entire time. So, which is why they continue being able to do events there. If you guys recall, the last events they had in person were all there as well. They had like 3 in a week because it was the only fucking place that would let them come.
Texas was in the news recently too. Like, they're not. I mean, in many parts of the United States, mask wearing is still optional, right? I don't think it's mandatory even when you necessarily go inside a store. It might vary by state, but I thought they were a bit more lax there. Is that correct, Amy?
So in the States, it is optional even when it's mandatory. So no, there are definitely, it is state to state and it varies greatly. So yes, Texas made the news recently, Alabama, Mississippi, because they lifted all restrictions, including masks. So what seems to be more common, rather than a unified set of states doing even somewhat similar things, is the corporate sector. So it's, instead of saying most states have, even similar guidelines, because they don't, it'd be easier to say like Walmart and Target and Public, like all these big public places and public transit, like they're requiring masks and distancing. So that's, in my opinion, easier to kind of describe than say, I mean, I can sit here and list you all 50 states and give you completely different guidelines for all of them.
Very interesting. I mean, Canada, we've been so good here. Like, the Canadians have been amazing. I still say that, no matter where you go, everyone is listening to the rules. I haven't seen any sort of dissidence at all. But,
down here we have mask burning parties.
I know.
Oh my God.
You know what?
Shit,
Actually,
what a country.
And here's even further on the other end of the spectrum. I was just talking yesterday, actually, to somebody I know who lives in Ireland, has been there her whole life. And she said the restrictions there are still so severe that not only is everything closed, like they can't get haircuts, they can't get their nails done, they can't do any of that, but that they can't even go farther than 5 kilometers from their home, and there's police checkpoints.
Wow.
Can you imagine? I said, if that ever happened here, you would see the mushroom cloud from there. That would never go. That would work. It would never happen, ever.
No, it's true.
Some places in Europe are mandating like you have to have N95 or the FFP2 or whatever was the name, the real masks. You know what I mean? You can't just have a piece of cloth on your face anymore. Mm-hmm. And some places I should suggest in double masking.
Yeah, that's so interesting, because even within our hospital systems here in Ontario, you're not mandated to wear an N95 mask unless you're going to do an aerosolized procedure. No, unless you're going to be exposed to aerosolized procedure. So if you're going to be putting a breathing tube in or exposed to someone who's on a ventilator, then you have to wear an N95 mask for sure. And you're going into a patient who has known COVID-19, there's high risk of COVID-19, you go into the N95 mask for sure as well. But just to, see low risk patients who screen negative, it's not even mandated in the hospital. So it's interesting how different countries have different rules. And I think making the community wear N95 masks, which are quite uncomfortable, honestly, is very surprising to me. Interesting.
Yeah, they're pushing for it, and they're pushing for doubles. And it's I'm not gonna say a country name because I don't remember, but I want to say Czech Republic. There's been a viral video of a man getting arrested for not having a double mask.
Holy
well,
shit.
I mean, he obviously probably shot some shit back, right? They didn't just tie him up right away. I'm sure he mouthed
probably drunk, started swinging.
Yeah, but the reason for the conflict was because he didn't have a double mask, and they tied him up. Took him away.
The thing is, when fear grips you, we sometimes, even as people, as lawmakers, make irrational laws that may not even make sense. So that to me does not make sense, to double mask in the community. And it makes sense to have a mask on and to hand sanitize and to socially distance. And that's, but to take it to that level probably shows you what that country is going through right now with the severity of the infections and the rapidity with which it's spreading. And people are making these kinds of decisions.
Well, not only that also just smacks of, we need to do something and feel and sound and look like we're doing something, but we don't really know what to do.
Exactly. 100%. 100%.
Would doubling up in masks even do, would it prevent any more? I saw.
So I wear a double mask. I wear a double mask when I'm in the hospital. Remember, COVID-19 is spread by respiratory droplets, and if the patients are in our hospital, the patients are masked, and the providers are masked with regular surgical masks, level 2 masks. Level 3 masks, but not N95.
Yeah.
The reason I double mask and why some of us are is if the mask doesn't have a visor, you're required to wear a visor to protect your mucous membranes in your eyes. So the reason I'm double masked is especially when I'm in a high risk ward, is I might have my N95 on or a surgical mask on, but you need to also have a special mask that has a visor on it. Now, our level 3 masks have visors on it, so one mask is good enough. But the N95 mask, which is the ultra protective mask, does not have a visor attached to it. So if you have an N95 mask on, that's actually not good enough in some ways, because you need a visor to protect your eyes. So that's why some people do double mask.
We're going to be wearing helmets soon, man. You know what I mean? Just isolated.
Holy
shit. Crazy.
So the third wave apparently Ontario is getting now. We've talked about this before. You don't know what the fuck to believe that's out there, right? You don't know what to believe. Even things that should be legitimate outlets aren't so legitimate anymore. What is the actual truth to this? Is it a real thing that's happening? Is it a thing that is on the brink of happening? Is it bullshit? What are your thoughts?
It's too early to say, guys. I honestly, I'm so isolated in London. I'm only looking at London data often, but I can tell you that the so-called London's doing okay, except we have this issue at University Hospital. But I mean, up until recently, we were down to less than 10 cases a day, new cases a day.
Wow.
And then over the last couple of days, though, it's gone up to 30 to 40 new cases a day, right? Yeah. So we are seeing an effect of the opening up our society, and but I'm very hopeful that this will be a blunted effect, and that we're not going to see a massive influx like we did with the second wave of patients who are sick. All of our long-term care residents have been vaccinated, have at least received the first vaccine. All of our healthcare professionals who work in the hospital have been vaccinated. We're getting even most of the medical students done. We've just started vaccinating, as you guys know, here in Ontario. Those who are 80 and older are all getting vaccinated and getting their first shots. Mm-hmm. We have now the AstraZeneca vaccine in addition to the Moderna and the Pfizer vaccine that's now available. And the advantage of that one is it can be stored in a regular fridge.
So are they not pausing the AstraZeneca one?
No, that's a good question, Amy. As you know, in Europe, they stopped it because there was a concern that there was a link to causing blood clots.
Blood clots, I heard.
But remember, blood clots are fairly common out there. And I think from my interpretation of what I'm reading, that it's too weak the data is too weak right now to make any link between the vaccine causing those blood clots.
Well,
now we'll
they've
have to
said
see.
that. They've already said that with the sample size of people getting the vaccine and the number of clots, it's no more high. It's no higher than the normal occurrence.
General population, and the
Yeah.
higher, that's correct. So and I see patients who develop blood clots. Just even though I'm a kidney doctor, I see it in my practice all the time because it's fairly common for patients with medical problems to get blood clots in the legs, and then you have to put them on blood thinners.
Mhm.
So right now in Canada, we're still actively giving the AstraZeneca vaccine, and I'm hoping that as this as the vaccinations start to ramp up more and more, that we will be able to protect our citizens so that even if they do get exposed to COVID-19, that their manifestations are not as severe. And, even in the mini outbreak that just happened at University Hospital, we've actually discharged the vast majority of the new cases, and we've isolated the healthcare providers that have developed the infection. So, I think there's going to be a third wave. It is real, but it's going to be a blunted wave. I really hope I'm correct on this, but that's my sense, and that we're going to be okay. But it also depends how we behave as a society. In London, there was at Western University, there was recently similar to your rave party, another party out there where there were people who were exposed, unfortunately. It depends how we behave as well.
I was gonna say, because in Kitchener here we had a meeting. We had a meeting with some videographer. Doesn't matter. We had a meeting which we were trying to have a breakfast, and it took us 45 minutes just to find a spot to get in with 3 people. You know what I mean? In Kitchener, it was a problem. And then in London, because I currently live in London, I'm not gonna name the spot, but I pulled up to a parking lot and it was packed. Right, so I sent my girl in. I'm like, go check it out because I don't think we're getting in. And she's just waving from the door. Yeah, come on, no problem. Packed.
Wow. Yeah. So it's
it was a little uncomfortable. I'm not too scared because I think I'm young and I will be able to handle it if it does come around. So I'm not gonna bubble myself in the house.
You're gonna get this shit tomorrow.
But with all the shit that's going on, right? I'm sitting and the bar is packed, right?
Hello.
Hello. Are you guys there?
Yeah, you're here, right? I think I feel like I look at the numbers and I forget the population difference. I mean, because the population of Canada, like the whole country, is only like 3 times the population of the state that I live in, or not even that,
I know.
So I think of it on a map, right? And I've been in Montreal, Toronto area, and I think of these cities and I think of all these people, and I'm just wrong. And so I'm like, how are you so slow when we're vaccinating 1, 2, 3 million people a day? And then it's just like the population difference is so vast, but my brain just never synthesizes that part of the story.
No, and absolutely. And I think the geographic size of Canada is huge as well for the small population. So we have populations of people like in, the remote areas even where it's going to, there's going to be some challenges in terms of making sure that the vaccine is delivered. It's a huge country with a small population.
How about them? The people in remote areas, do you know if they got hit with COVID?
Absolutely. There have been some of our Indigenous citizens where there's been outbreaks in tribes, for sure. So even remote areas have been hit with COVID-19 for sure.
Now, are they with everything here that is staggered is primarily by age as well, and first responders, healthcare workers, and all that. Do you have also like special medical allowances for medical conditions, or is it strictly by age right now?
So, Amy, that's a great question because the interesting fact is, if you're an 81-year-old marathon runner, so you're 81 years old, you're in tip-top shape, strong, muscular, you're on no medications, you have no medical problems, and you run marathons. Comparing that person to a 55-year-old kidney transplant patient on immunosuppression, if both of them get COVID-19, the 81-year-old has a higher chance of dying. So the most powerful predictor of dying from COVID is your age.
Right.
So the way I think the approach Canada has taken has been driven by age and not so much by medical comorbidities. I work with patients who have developmental disorders, who have things like Down syndrome or other similar medical issues, where their risk is still lower than patients who are older. So I think the strategy Canada has taken is the right one, to primarily go by age. And so that's what we've been doing here.
How how frustrated are you getting over all of this? Because right at the start, you're like, I'd love to talk about something else. And throughout the past 2 times we've had you on, you seemed really optimistic that we were closing in on an end. No, you didn't, specify on a date or a certain period of time, but you felt like, we're on the right track here. But are your patients wearing thin?
It is. And part of it is my job. I'm the site chief of medicine at University Hospital. So anytime there's an outbreak, anytime there's an outbreak within the hospital system, especially, it occupies all of my time. I'd rather be taking care of patients, teaching medical students, teaching residents, and not focused on this administrative bullshit of dealing with this, right? Mm-hmm. And it's important work, don't get me wrong, but I'm getting sick of it. Like when I had to shut down my hospital wards, the medicine wards, to admissions. So then I'm spending my time moving patients from one hospital to another. It's just, and it is wearing thin on, not just on me, but especially on our nurses and doctors who are putting all of the work and taking care of patients under horrible circumstances. And kind of what I told you guys last time, I feel for the non-COVID patients, like all of the patients whose operations get canceled or who have to be moved from one hospital to another, which is very disruptive to their care. So it is wearing thin. It's wearing thin on me personally too. Like, we want to, all of us want to be able to travel and experience life and experience culture and that our way of life has been taken away from us. And
I just want to go to a concert.
Exactly.
Fuck all the rest of y'all traveling and everything else. Stay home, watch some music.
Exactly. 100%. 100%. And I know, but I feel it, Amy. I'm super frustrated. Like, every March we have a trip where all of the guys go to Vegas and we take in a fight if the UFC's in Vegas and stuff. All of that, the enjoyment of life has gone away. Now it's temporary. We have to be patient, and I tell myself that all the time. But it's wearing thin on the general population. It's wearing thin on me, and I'm supposed to be someone who tells other people to be patient and be calm. And so
I mean, I'm kind of joking and just being dramatic, but the realistic thing is, here we all are sitting here having this raving conversation on St. Patrick's Day.
Oh yeah, it is St. Patrick's
nuts.
Day.
Yeah, and I'm drinking a Diet Pepsi.
Yeah, I could be at a
glass
bar.
Of water.
I don't even go to bar. I don't even like bars, and I wish that you guys didn't exist and I was at a bar right now.
Exactly.
Anyway.
Yeah, when the lockdown lifted here, I had to go get a new phone. Well, I didn't have to, but I wanted to. And I went to the mall, and I fucking hate going to the mall. I only go unless I absolutely have to. And it felt so good to just be in the mall. And it wasn't real crowded, but there was enough people there. And it's just like, oh, look, the teenagers are enjoying themselves, probably getting up and getting into trouble later. And like, oh, look at these people. It was just nice to see people out and about. So yeah, I get what you're saying, Amy. Even I've been to like fucking 4 movies in the theater my entire life. But if everything's finally safe one day, I might actually go to one and enjoy it. And not take it
the funny thing is, I don't know if I should be saying this on the podcast, but there was a time I did take my kids to a movie 3 weeks ago, like after the second wave, but before this third one. It was several weeks ago when the theaters were open briefly. And just to feel normal. And you know what? We were the only ones in there. So weird. And the movie was
not normal.
Some fucking old movie, some shitty movie. It was horrible. Like, there's no new movies coming out, right? I haven't seen a new release, like high quality new release movie.
Really? So they are down here.
Okay, there was some shit movie that was like playing from fucking 5 years ago. And this was Silver City, like it was a big movie theater, like where there's an IMAX and stuff. At least at that time, they didn't seem in Canada, in London anyways. There was no new releases coming out. And all of the new releases are coming out on Netflix or on Amazon Prime, or like you can't even go to the theater to watch a high quality movie, it seems. So it is weird. The whole thing. At least they
let you in the building. Jesus Christ.
Yeah, I know. I shouldn't complain. And you know what? I really shouldn't complain. I mean, but I do feel like, imagine what our small businesses are going through. How many restaurants have gone under? How many my dry cleaner guys suffering? Everyone is going through so much economically. We can't. It's been horrible.
Talking about economically, have you heard of this man named Roman? I don't want to say it wrong. Baber. Baber is the right way to say it. Roman Baber, who's he was working for Doug Ford, and he got dismissed because apparently he came out with a statement from 14 or 15 doctors in Ontario saying that lockdown is actually hurting more people than helping. Yeah, because he was claiming all kinds of suicides and overdoses and all of that with it, right? Not just the financial, but he was also saying that businesses are diving, like you said, right? But a bunch of businesses are closing down. How do you feel about that? Have you heard about that?
He should not have lost his job. I mean, people should have their opinion. I mean, even though I might not agree with that, I do know that because of these restrictions, people are suffering 100%. And businesses are going down, and there may be an argument to say that in specific countries the restrictions are more harmful than good. Maybe there is some data. I don't know. I don't think we should be firing people for voicing their opinion.
This is here in Ontario, and he was working under Doug Ford, and he said he got 14 or 15 like medical doctors from Ontario backing him up, giving statements that the lockdown, that there's no evidence of lockdown helping the cases, and that it does more harm in terms of overdoses.
Yeah, and I think if he's in Doug, I don't know. I didn't hear about the story, but if he's in Doug Ford's cabinet, I guess Doug Ford has the right to kind of fire him because that doesn't represent his view.
Dismissed him right away because it was I don't know. And the news are a horrible place to get news nowadays. You know what I mean? Because it's just everything is either fear mongering or whatever the word is, or you know what I mean, or it's not a clear story. Then in the news, from what I understood, Doug Ford dismissed him right away just for standing up to him and saying that Doug Ford's opinion might not be right. But I don't know how much truth is to that.
Yeah, but listen, I hear you completely. I think even if I disagree with someone, we need to let everyone have their opinion. Yeah, and then you know what? If it's not true, it'll be drowned out. But I think firing someone for having an opinion is not good. And I think it's a reasonable argument to say that the COVID-19 pandemic has harmed, and the restrictions because of it have harmed a lot of people. There's nothing wrong with saying that and debating about what is the proper way to move forward. Do we need to do all of these measures or not? And in the end, you know, make a decision for yourselves in terms of what you believe. But you know, personally, I think in the interest of public safety, the data is so strong for social distancing, wearing masks. You know, I think these things need to be continued. But with respect to how businesses are operating and what we can do to ease their burden, and talking about the harm that the restrictions are having on society is super important. And we need to be able to evolve our thinking and evolve the way we plan based on that, and not just say that we're going to stay in masks and social distance and forever. You know, so I'm disappointed that his opinion was not heard and that he had to lose his job over it.
It was sort of a decent PR move too, right? Because that gave him exposure and a spark. I don't know. He kind of disappeared, but we're trying to talk to him. But it's impossible.
We're trying to get him on the show. We've talked to his constituents. Say that with air quotes, because that's the only people I can get through to. And we
wanted to hear who these doctors are. And
I want to know what the damn story is here. And like I agree with what you're saying. You know, but even if you don't agree with his opinion, that's still a conversation to be had, right? So
yeah. Absolutely. I think you have to be careful though when you're representing the Conservative Party of Canada, let's say, or you're representing the Premier, and you go out and say something that's completely against what the Premier is saying. If that was his role, like if he was in his cabinet and he said that would be, you know, that's where you have you'd have a discussion with your boss behind closed doors. You don't go to the media and say something. So it really it depends on the details of that story.
I think the point was that he tried and all that, and then at the end of the day, he went against the Godfather and got fired.
Yeah. Exactly.
Amy likes to tell people about what free speech actually is and what it isn't, and then how there are consequences for things. You're not allowed to just go say shit and whatever you want. You can be fucking penalized for that.
No, you are allowed to say whatever you want.
Oh yeah, you're allowed to.
Yeah, you can say whatever the fuck you please. That doesn't mean nothing's gonna happen to you.
Exactly. So going into this stuff, this bullshit, we heard about there's gonna be a second wave and possibly a third, but I've never heard anything this whole time about a fourth. Is that a thing that is, you know, expected with viruses like this? How there's waves, there's trends, whatever.
You know, that's the thing. It's it's not happened in the recent past, right? Like just to go back in time, in 2003 with SARS, it was very quickly contained. And there was only comparatively a very few number of deaths. I used to know the numbers offhand. I think it was like over 9,300 deaths worldwide. Between 20 and 30 countries were involved in that pandemic. But believe it or not, since 2004, so less than a year after it started, there have been no new cases of SARS.
How did that happen?
Right.
How did that just
And that's the thing, right? These viruses are different. So this is not typical at all. Same thing with MERS, which is the Middle Eastern Respiratory Syndrome variant, very quickly contained. Only 3,000 deaths, I think. And again, it was very quickly contained and is not really had a resurgence. The thing that's different about COVID-19 is how contagious it is. It's actually less deadly than SARS and less deadly than MERS, but just super contagious. And now that it is showing signs of mutations, that does bring us additional challenges for sure. In the past, we didn't care, right, with coronaviruses, because you guys were getting coronaviruses every year. You'd get a common cold, you'd get sick. The same cold would get you the next year. It was the exact same one because you lost your antibody response to it that you developed when you were first infected. So, but the thing is, it was a mild clinical problem. You got a cough and cold, and a week later, you were better. The problem with this virus is it's very contagious, just like the other coronaviruses, but it has more severe clinical manifestations, especially in our older patients.
And as we get different variants of COVID, is that the testing, the nose swab or whatever it is that they do now, is there something that could be missed in that when they're doing the tests, where those tests become inaccurate?
Yeah, I'm hopeful that it won't. We'll have to see as these new variants come out. So far, the testing is picking up these variants, and they've been able to modify the testing to pick up the variants. But viruses are smart, and they will continue to mutate. So our main hope, though, is that, again, this will eventually burn itself out. We are seeing that. I mean, we have to be staying on the positive note. We are seeing way less infections than we were historically. We're seeing way less hospitalizations than we were, 6 months ago. Less ICU admissions. So we are making headway, right? I think the thing that's frustrating for you and I and everyone out there is, when can we start to live normally? Really, that's the main question. Without being scared for our lives, it breaks my heart. My parents live 1 block from me, and I they're too afraid for me to even come and visit them. Right, and they're fairly old now. So when can people overcome their fears and start to live life a bit more normally and not be so isolated?
Yeah, that's really shitty. Actually, that's crazy too, because you think about people that can't visit family. They're usually saying that they live in different countries or even different provinces, different states or whatever. But like you saying, they live that close, and still, just because of their age and what could possibly happen, you can't even see them being that close to each other. It's crazy. Yeah. And I feel for young people too. You know what? I mean, young people who want to date, want to meet people, and, this has got to be devastating for them too. I mean, it's horrible when I drive by the university and there's no students there. There's tons of, everyone's registered at Western University, but they're all doing it remotely. So it's just, it's difficult for everyone. What's that like, teaching remotely? Have you had to do that? I fucking hate it, man. I'm doing it right now with you guys on Zoom. I've got a lifetime membership and stocks in Zoom now. It's just brutal. It's brutal. Like, I mean, I loved when I would lecture in front of 180 med students. We joke around, make it, make it a kind of a fun learning experience. And we're trying to do the same on Zoom, but it's just not the same. You can use the chat box function so much. You can try and jazz it up, but nothing is, for a teacher, nothing is better than teaching in person. Yeah, and especially some students that need an extra little bit of help or something, that probably has to be even more difficult on Zoom. Oh, absolutely. Like, after a lot of the stuff, action happens after the lecture's over, and students come up to you saying, I'm having a hard time with this concept. Can we meet later to discuss it? Or those small conversations you can have with people in small group sessions, where we can, again, take a group of 10 students and show them, physical exam. Like, how do you practice physical exam on a patient when you can't see? Yeah, no shit. You can't practice on each other. How do you learn how to do a proper
heart exam or a proper lung exam when you have no one to practice with because of all these social distancing rules. So it's tough.
Well, something else that you don't get to do as much as you once were not too long ago is the stuff with MMA and combat sports in Ontario, but you do get to watch it. And now we're going to talk about some of it. Did you watch UFC 259?
Yes.
Holy shit, what a card. Where do we even begin? What did you, at the top of the card, what did you think? Israel and Jan Blachowicz going in, Israel trying to go for the champ. Did you think he was going to win, lose? What do you think his chances were?
Yeah, you know what? I was like with the majority of people. I thought Israel was going to win. He was going to dominate with his kickboxing and was going to just toy with him, right? Yeah. But you know what? Jan is a big, strong guy and was able to take him down. And then Israel had no response. He had couldn't get off his back. So he, it just showed the weight difference. I think was hard for him. Yeah. And also he's, if he's taken down, if he can be controlled by a stronger guy, that's not good. He didn't seem to have any good wrestling defense in response to Jan's takedowns. I think he won the first couple of rounds. I think he won some of the early rounds, but then and the other thing about Israel is he's very much like Anderson Silva in that he picks his shots. And so there'll be long periods of time of inactivity where he's just fainting and fainting and fainting and fainting and fainting and not throwing. So in the end, I was actually happy he lost because I didn't like his performance. It wasn't entertaining to watch at all. I actually didn't like that fight. But Jan won, and I was happy for him.
Yeah, and going back to middleweight now, you might see some of the bigger, bulkier guys try to take the same game plan to Israel when they get that crack at him. Because we've seen that happen before when people try to go up in weight or just take an offhand fight and it doesn't go their way. Sometimes it creates the blueprint on how to beat them.
Absolutely. It's a great point. Conor McGregor, I think, is a great example of that for sure. You don't move up and then you see their weaknesses. So it's a good point.
Mm-hmm. And the women's featherweight championship fight, Amanda Nunes versus Megan Anderson. Going into that, nothing against Megan Anderson at all, but I was just like, shit, this is probably not going to work out well for you. And it didn't. It didn't at all. What were your thoughts on that going in?
I think Nunes is just so far above her competitors. It's going to be difficult to find anyone who can compete with her. The one person who can, what's her name? The Russian. No, is she Russian? She's the champion in the 125, I think.
Oh, Valentina Shevchenko.
Shevchenko, yeah.
Oh, I love her.
I think if she moves up to 135, I think that's the plan. If she moves up to 135, that would be she would give her a reasonable fight, I think. But Nunes is just so far better than anyone else right now at 135 and 145 that I can't see her being upset. Now, someone will come along. We used to say the same thing about Ronda Rousey, right? Mm-hmm. Someone will come along that will beat her, but it's going to be tough to find someone.
Yeah, I don't think they're on the roster as of right now. I don't see it.
No, she's the most dominant champion, man or woman, right now.
Yeah,
in the UFC. She's amazing. She's amazing. I ran beside her in Vegas. I was in Vegas on a trip with some of the guys, and she was there for one of her teammates, I think, just cornering her. And I ran beside her on the treadmill. And she's an athlete. I mean, she's a well-developed, strong athlete, and I think it's going to be very, very difficult to beat her.
And the bantamweight title fight, Aljamain Sterling versus Krill. You say his name?
Petr Yan.
Yeah, Krill has to say it for me.
You know what? Jan is that's how you say his last name, right? Jan.
Yeah.
He's a mean guy. When he fights, he doesn't give a shit. He'll fuck you up, and bite you, and elbow you, and I think, he made a poor decision when Sterling was down, kneed him right in the head, and that was a vicious knee.
The claims are that the corner was yelling to do it, eh? That he couldn't see properly, and somebody from the corner yelled, do it, and he did it.
Yeah, that's what they claim, and Khabib Nurmagomedov was saying the same thing, that he heard them saying that, but it's hard to know with the language barrier. They may have been knee him to the body, right? You can knee someone down opponent to the body, but not to the head. Mm-hmm. So that was
that was an execution.
Yeah, that was a dumb decision on him. He was winning the fight. I think he would have beaten up Sterling. I know they said it was close and that the judges had it split, but in my opinion, Jan was coming on and Sterling was fading. He was getting tired, so they need to redo it, and I think Jan will win. I don't think Sterling wants to be a champion this way, so by disqualification. So I look forward to the rematch. That was an amazing fight up until that moment. It was a great fight.
Yeah, that whole
Oh, my
card
jaw
was
dropped.
good. What's that,
My
girl?
jaw dropped on it. I'm just like, what? He was dominating. What just happened?
And the ref too. The ref's like, "Don't throw that knee." Boom!
Yeah,
I was like,
but
"Oh no!"
yeah, but I think the language barrier also. But it's just a poor decision. He's got to be smarter.
Mm-hmm. And that ended up being well, the doctor stopped the fight. Would you have stopped that as well? The way
Oh,
Aljamain was
absolutely.
acting,
He couldn't compete. It was done.
he couldn't even stand up. He looked like he was like loaded drunk. He was stumbling around everywhere, and that was bad. Is that the guaranteed concussion?
Absolutely, that's a head injury, and
man.
he'll recover from it. But that was a good stoppage.
Mm-hmm. Yeah, that whole card was really good. I watched it all the way through, and there was something on this last card. I should have pulled this up earlier.
Well, the eye poke with
oh my god,
yeah, that was they've got to do something. And
Bilal, hook, though, that was like an entire hook.
Yeah, no, he got hit right in the eye, and the problem I really like. What was his opponent's name?
Leon Edwards.
Leon Edwards. He's a fantastic fighter, fantastic.
Mm-hmm.
But he was leading with his fingers open, like pointed towards Bilal the whole time. You have to have your hand cocked up so your fingers are pointing towards the sky if you're going to have an open palm. And he was leading with his fingers. It happened once. They didn't take a point off. And then it happened a second time, and it's just deadly. You can detach someone's retina and cause severe damage, right? So it's the most painful thing. So they've. I agree. Bilal put it in his Instagram post recently that when you do that kind of foul, it should be an immediate point deduction, not a warning. And I agree with that. It's so serious that an eye poke should be a point deduction. That's the only way you're going to keep your fist closed or keep your fingers pointed in the proper direction so that you're not going to injure your opponent. It's going to be difficult to design a glove that prevents that allows you to grapple and allows you to do jiu-jitsu.
Wasn't there a company offering some glove to UFC with covered fingers, and Dana White didn't want to do the contract? I've read an article about it.
I wouldn't be surprised, and I'd love to see that glove. I can imagine it would be a difficult design to allow the freedom of the finger movements to be able to do grappling, but maybe someone designed something that prevents the finger poke. I'd have to take a look at it.
Everlast makes the Bellator gloves down. They have a slight curve, almost like the old Pride FC gloves.
Right.
But it's not enough. You can still put your fingers straight out. If you know what I mean?
Yeah.
If you make your hands stiff and put it straight out, your fingers will go straight out.
We'll go straight. Exactly. You can still overcome that resistance. I'm sure.
Yeah, exactly.
And that was so bad. I read it was either one of Bilal's comments or one of his corner mates' comments that he got poked so bad that he started screaming and crying there because he thought he lost his eye.
Oh my god.
Yeah,
that's why he was freaking out like that. He just dropped.
I've never experienced it, but when I talk to other fighters who've experienced that, it's the most pain. It's worse than getting nailed in the balls. It's a horrible pain. Horrible.
Oh, I bet.
And the same thing happened to Anthony Johnson, who's another top light heavyweight.
I remember that.
Remember when he fought at 170, he got fingered so bad. He was out for a year and a half or 2 years, I think.
Yeah,
because of how severe the injury was. Yeah.
Look at Bisping. His eye was destroyed to the point he had a glass eye and still fought. I don't know if he's all right in the head.
That was old TRT though.
Yeah, TRT Vitor.
Shit. Yeah, no, that they do have to do something, but at least penalize it. Like even if it's unintentional, you almost got to wonder if you should just penalize it, because it's just people got to keep their fingers, either their fists clenched or their fingers have to be pointed in the right direction.
Have you had to stop or like examine someone who's had a nasty eye injury during a fight?
No, but the fight I'm famous for stopping was the Ortega fight. Ortega when he fought Holloway.
Yeah.
That was one fight I stopped, but I've not had to stop for a bad eye injury. I've stopped a pulsatile bleeding cut on the forehead when Caro Parisian was kneed by Ryan Ford at the first ever Ontario MMA event in London.
Yeah, no, I thought it was it MFC?
It was a promotion that no longer exists, so it might have been that one. Yeah, and so that was the very first event that happened in Ontario that was legal, and that's why I stopped that fight as well for a bad cut. So I stopped fight for cuts and for bad head injury, and the fighter was really unable to continue, but not for an eye injury.
And also on that Leon Edwards card, a little earlier in the night, Eric Anders and Darren Stewart. Eric Anders hit Darren Stewart with a knee when he had 3 points down, but Darren Stewart put his arm up to cover his head before Anders' foot left the ground, and he kneed him in the forearm, and the ref stopped the fight. Do you think is that a legal strike? Like how much?
That's interesting. That's interesting. I missed that fight, but that sounds like it would be legal because my understanding is you are allowed to knee a downed opponent to the body, and the arm is part of the body.
Yeah, and the arm was there first.
Yeah, so I don't know if the referee maybe mistook it for a headshot. You know, it could be, but you're allowed to knee someone to the chest, to the shoulders. You know what I mean? So the arm should knee to the arm in a downed opponent is legal in my opinion.
That's what I thought as well. Are you allowed to kick the body of a downed opponent?
So you can definitely kick the body of a downed opponent. You'll see them do that with I don't want to use the word stomp, but it looks like it, where they slap their leg, the leg down on it. If opponent is in the kind of in the guard position and someone's standing on top of them, they will try and bring their leg down in almost a scissor kick kind of movement to try and enter the body. So you can definitely do that.
Can you like soccer kick them if they're on like on their knees?
So
you can't soccer kick them in the ribs. Yeah, I know you can soccer kick them in the head then, but I mean to the body. Can you kick them to the body or no?
Yeah, and they usually bring their kicks to the body from the side.
Yeah,
but and they're usually focused on kicking the legs. You're right. They don't try and get around the body. It's difficult actually. If you're in proper guard and you're in the proper defense position, it's actually very difficult to try and get your kick around to hit the body.
Yeah, and the next big one they got coming up, March 27th. That's the UFC 260. Stipe and Francis. What do you think about that fight?
I think it's going to be a great fight. I think I'm hoping Francis Ngannou's improved his wrestling because I think if he can improve his takedown defense and his cardio's top notch, he can knock anyone out on any given day, right? The guy is a freak of nature. He's powerful. And so I'm going to pay to watch that fight for sure because it's got me intrigued enough. But I wouldn't be surprised if Miocic, who's a wonderful athlete, again, just uses all of his tools to take him to the ground and dominate him. But I think the power of Ngannou, always has you thinking, you know what, maybe this time he's got him. And I'm hoping Ngannou's not the same fighter that he was when he fought Stipe for the first time. So it's a good fight. If I was a betting man, I would probably pick Stipe Miocic.
Yeah.
But you know what? Ngannou's 1 second away from being a heavyweight champion with just one punch.
And the winner of that gets the gift of John Jones at heavyweight. Who do you want to see him line up against out of those?
You know what? I believe it or not, I think Miocic has the tools to beat John Jones more than Ngannou. Yeah. I mean, John Jones is a killer wrestler. They don't talk about how good of a wrestler he is. And I think he, I really think Ngannou would have a tough time with John Jones. But Miocic, I think, is a different beast. I think that would be a super fight, Miocic versus Jones.
What do you think about John at heavyweight?
I think he's I've had the pleasure of being the lead physician for 3 of his fights when he fought in Toronto. And the guy is a incredible athlete, incredible. And but he's a small light heavyweight, in my opinion, compared to some of those guys.
Really?
So I think he meaning he has the ability to fill in more. He's pretty slim.
Oh, okay, I can't
and
so now.
So I think if he puts on 30 or 20 or 30 pounds of effective muscle and doesn't slow down too much, I think he's just such an amazing athlete. I think he'll excel at heavyweight. I don't Israel Adesanya and John Jones were calling each other out all the time, but I think John Jones is a different athlete than even Israel. They're different levels, and I think John will excel at heavyweight.
All right. Anything else you guys want to get in before we let the good doctor go?
The good doctor.
The good doctor.
I'm not sure I'm a good doctor.
Well, we can cut that part out. But
we see you've been doing some modeling lately. We got to get that in.
Don't kill my vibe here, dude.
All right, take it over, Amy. Take it over. Take it away.
I got questions, sir.
Oh.
What was the impetus of this photo shoot? Because it felt like we were trying to give some props to the jacket or the maker or giver of the jacket, and I feel like that is a lie.
No, that's a lie. Yeah, I'm actually pretty I'm pretty jacked. Just so you know, I mean, I train all the time. I mean, one good thing of COVID is I got my abs back. There's nothing else to do but work out. So I've been having if you want to know the truth, I've been having a midlife crisis for the last 10 years, and that was just one small part of my midlife crisis. So I have to have a photo shoot before I lose all my hair and get more and more, age more and more. So it's just for my own ego, frankly.
I mean, they're great pictures, but what did I say, Jason? I was like,
Jay-Z-ish and something? Real Jay-Z
No.
look on him?
So one of them where you had clothes on, you had a Jay-Z like look on your face. And then one of them, you just felt like, what did I say? I said if Macklemore was a Canadian doctor.
Oh yeah, something like that.
Yeah.
Let me see if I can find that.
Yeah,
you guys keep chatting for a second.
It was about Macklemore. And look, I am busting your balls because that's pretty much my function on this show. But no, like it was actually funny because like we've been talking about every time we talk to you, how crazy and fucked up everything is. One thing, at least for me, somebody who spends a lot of time on social media and had an entire career in it, that has been lacking noticeably is like actual pictures of things that aren't the inside of somebody's house, professionally shot, actual. So like that was actually why I noticed it. I saw it go by and I was like, oh, this must be an ad. Everybody's shitty pictures of their dinner at home on their timeline are desensitizing me to actual like good pictures. And then I scrolled and I was like, what the fuck are you wearing? What is happening? Yeah. What is going on here?
That was at the risk of being beat up by some animal rights people, it was quite a nice fur coat that I was wearing, actually.
No, it looks like a nice coat.
But one of my buddies, actually, he's a phenomenal fight photographer, actually. His work is amazing. His name's Mark Ruddick. And he has taken a few shots of me when I was competing in kickboxing and boxing and mixed martial arts and stuff. He'd always be at the fight events, the amateur fight events where I was fighting at. So he also takes pictures of me that have nothing to do with fighting. And so I said, I got this nice fur coat. Can you take some pictures of me? And he said, sure.
I love this. I love it.
So we had that photo shoot.
So what is the likelihood of you coming back on this show ever again if I take one of those pictures and use it as our Instagram post when we post the show?
Well, for sure. I'd be happy to. I'd love it. That'd be amazing for my
because that's happening. All right.
That would solve all my problems. Let's solve all of my problems.
And you can rest assured. Oh wait, I don't know enough TV to make this joke. There was about to be a joke coming about some kind of doctor that everybody loves. Is House one of them? No. Who's the one? There was a doctor that everybody. Oh, Patrick. No, fuck. What's his name? Everybody used to call him Dr.
Clooney.
George Clooney. That guy. There's going to be a Clooney joke in there somewhere. But
they love him. Yeah.
Okay. On a more serious note, one thing I really was curious about. Other than seeing your parents and possibly another human if you go to a movie.
Hold on. You're not going to tell Macklemore MD?
Oh, well, it's kind of the same thing. Yeah, that's what I said.
That's the name. That's the name she said the other day.
That would be a perfect screen name, in fact.
I love it.
All right, Amy.
Yes. Sorry, so other than seeing your parents, seeing a movie that isn't a shitty movie, you should see Coming to America too. That was fun. What are you going to do first? Like, what's the first thing you legit do when everything, I'm not going to say back to normal because I'm so hateful of that phrase. I think people don't understand that's not a thing, but when things are lifted and you can move about the country freely, what is the very first thing you do?
It sounds terrible, but I want to go to Vegas. I have so many good memories of hanging out in Vegas with my friends. Mm-hmm. I just want to go to Vegas, go to all the best restaurants, gamble, go watch the shows. I hope the Circus du Soleil shows come back.
They will.
And just take, I heard they went bankrupt and stuff, right? So I want to go, like you said, I want to go see a concert and just do this. That used to be my yearly thing that I would do with my friends. So I'd love to just be able to do that. And the next best thing is I want to go see a fight. Like I want to go see even here in London, Ontario, a sports combat event with thousands of people in the audience. And just
I know you probably know this, but you could kill two birds with one stone.
Yeah, by going to Vegas and watching the fight. Yeah. And that's what I used to do. I used to go there and I watch a UFC event or a boxing event and stuff, right? And so I just love to go back and do that.
Fuck it, man. My first trip was going to be New Orleans, but if you promise to bring the coat, I'm coming to Vegas.
Yeah. I love New Orleans. I love New Orleans. That's a great city too.
Are you still? Last time we spoke, it was late December 23rd. It was right before the lockdown happened. Are you still planning on or looking into the possibilities of throwing some sort of event in the fall?
Yeah, so in the fall, believe it or not, we're having. I'm working with my committee, and Jamie Champion's one of my friends who's on our committee.
We had him on
we're
a couple
actually,
months ago.
Yeah, we're doing a virtual event with Brendan Schaub, who's a former UFC fighter turned
wow.
comedian, and so I've just received the contract today. So I'm hoping to sign it and send it back, and we're gonna hire him to deliver a comedy show virtually. It's just
Do you need a heckler?
Yeah. You guys are. We'd love to have you guys there, but it's gonna be a virtual comedy event. We're just too chicken to go do anything live yet, even though it's not till September the 25th. So the year after, we're definitely, if things are better, we're gonna do a live combat sports event for sure.
So you're thinking we got another year on hold, eh?
Well, at least for our charity event. I hope it won't be that long, but for our charity event, I think it's too much risk for us to try and do a live event in September. Yeah, so September the 25th, we'll have Brendan Schaub delivering a kind of a comedy night.
Well, we'll have to have you and Mr. Champion on to talk about that as we get a little
I'd love
closer to it.
Thank you. I'd love that. We'd love you guys to be there. The event is usually free. It's free for people to attend, and we just would like to raise awareness about our charities and stuff. So that'd be amazing.
Yeah, no, we'll definitely line that up. Like I said, we had Jamie on a few months ago. I've obviously done lots with Jamie over the years, covering combat sports, whether it be UFC level, and obviously I try to give as much as I could back to the local level, regional shows, and even the amateur stuff going on. So Jamie and I have known each other since MMA Diehards days in the early 2010s. Actually, when we called him, he started laughing because he said, when my name comes up on his phone, it still says MMA Diehards. Wow. He's like, I've known you for a long time.
He's a great man, Jamie.
Yeah.
And he's done a lot for the mixed martial arts scene in Ontario. You can't even imagine all the hard work he's put in the background to help athletes and stuff like that. So he's been an amazing asset, I think, for Ontario, for sure.
I think you have the same reputation amongst combat sports athletes in Ontario, my friend.
I don't know about that, my son, but but Jamie Champion for sure. I mean, without him, I think mixed martial arts would not have flourished as much as it has in Ontario.
Okay, well, we will let you get out of here now, unless there's anything else you want to add, Faisal.
No, you know what? Thank you very much, guys. Thank you for having me on your podcast again.
Hey,
I honestly do hope.
Could you actually use Twitter, and then also now you can plug it?
Say that again.
I said, could you actually use your Twitter, and then now you can actually plug it?
I know. I don't. I'm really bad at social media. You have to teach me, Amy. I mean, I only use Instagram and Facebook, and even those I probably don't use properly. Sadly.
I know how you feel. Trust me.
Aww. Yeah, but you know what? I hope one day we can get together in person, even, and
that'd be awesome.
A fight event or a dinner, or just and not talk about viral infections.
Yeah,
that would be
shit. Talk about anything else. Parking tickets. Who gives a shit?
Exactly.
Wow.
Exactly.
Okay, Faisal.
Thank you for having me on.
Thank you for coming through. And we'll be doing this again. And keep us in the loop. I'll talk to Jamie as well. Keep us in the loop with what's going on. We'll line something up to get some promotion out about this. And
I'd love that. Thank you so much. Thank you so much, everyone. I love it. Take care, guys.
You too. Talk to you later, Faisal. Have a good night.
Bye. Bye.
Building downtown. Building downtown. Building downtown. Building downtown.